A child has come to us for decortication surgery. His age is at least 6 years. First, we will insert an IV line so that we can administer anesthesia, medicine, and fluids. As you can see, we have inserted a 20 gauge pink IV line. Now we will take blood from the IV line for cross matching so that blood can be arranged for the patient. As you can see, we have given anesthesia medicine and the patient is now anesthetized. We are now ventilating the patient on an open circuit. This is a pediatric circuit. Next, we will intubate the patient with a size 4 endotracheal tube. We will now insert the tube into the trachea. Laryngoscopy has been performed, and with laryngoscope we have visualized and cleared the trachea for intubation. As you can see, the anesthesia consultant has inserted the tube. It is a size 4 tube. Yes, the tube is in a place. Now we will fix it, and along with that we will inflate the balloon so the tube will fix. As you can see, we have inflated it with a syringe. We will now check both lungs to confirm that the tube has been placed correctly. We have already auscultated the left side and now we have auscultated the right side. Next, we will secure the tube with stick and tape so that it does not come out during surgery or while positioning the patient. We will also cover the eyes with stick and tape so they remain closed during the procedure. As you can see, we have positioned the patient in the lateral position with right side up because the surgery is on the right lung. Here are our instruments and the sterilized trolley. This is our staff and they have prepared everything carefully for the child. Now the surgery has been completed and as you can see, the patient is in the recovery stage. We will now help the patient recover from anesthesia. Using suction will clear the tube to remove any secretion from the trachea or esophagus. Now we have extubated the patient and after extubation we will provide some oxygen so that the patient can fully recover. Thank you. Now subscribe our channel and click on the bell icon and share with your friends. Thank you.